Breathing is an autonomic process, and we often take advantage of it. We forget how necessary it is to life functions. Air enters through the nostrils and goes into the nasal cavity. Then it goes down to the pharynx, to the larynx, down the trachea, and branches into the bronchi of the lungs. Here it goes into the bronchioles, where it finds its destination at the alveolar sacs. In order for proper respiration, these channels must be clear. During inspiration, the ribs move up and out, and the diaphragm contracts downwards, which then increases the volume of the lungs and reduces its pressure. This causes the air to be forced down the pressure gradient, and oxygen enters the body. During expiration, the ribs move down and the diaphragm relaxes. This decreases the volume and increases the pressure in the lungs, which then forces the air out. This disposes of excess CO2 built up in the body. When this process is incomplete, excess CO2 causes pH in the blood to increase. Acidosis is defined as an excessively acidic condition of the body fluids or its tissues. A normal pH ranges from 7.35 to 7.45, but in acidosis, people have a pH lower than 7.35. There are two types of acidosis: metabolic acidosis and respiratory acidosis. Metabolic is more complicated and least common. This is when the kidneys are unable to eliminate acid or they dispose of too much base through urination. There are many types of this, but one is diabetic acidosis. This happens when diabetes isn't properly controlled and the body lacks insulin, so ketones build up and acidify the blood. Respiratory acidosis occurs when too much CO2 builds up in the body. This is usually a result of the lungs' inability to remove CO2 properly. Obesity and asthma are very common causes of this because of the extra resistance put on the air pathways. Diets that are high in fat and low in carbs, along with diabetes and obesity, all put you at a greater chance of getting acidosis. Most people with acidosis don't even know they have it. However, it can cause nausea, vomiting, fatigue, headache, and drowsiness. And when left untreated, it can lead to kidney stones, kidney failure, and bone disease. Diagnosing acidosis is easy. A simple blood test indicates the pH of the blood, and a pH lower than 7.35 is an acidosis patient. For those with metabolic acidosis, treatment differs depending on what is causing the acidosis. For example, diabetic acidosis, one would better regulate insulin. With respiratory acidosis, improving lung function is the main treatment. Bronchodilators such as albuterol are given to the patients to open up the pathways and allow better breathing and more CO2 to be let out of the body. In conclusion, acidosis may not have many symptoms, but it can be life-threatening if untreated. Therefore, people, especially diabetics, obese, and asthmatic, should get their blood tested and make sure they don't have acidosis.